A stroke, often referred to as a cerebrovascular accident, CVA, is a medical condition that occurs when there is a disruption in the blood supply to a part of the brain. This disruption can be caused by a blockage in a blood vessel, ischemic stroke, or by the rupture of a blood vessel, hemorrhagic stroke. Strokes are serious medical emergencies that require immediate attention and treatment. There are two main types of strokes. Ischemic stroke. This type of stroke occurs when a blood clot or plaque buildup blocks an artery, reducing or cutting off blood flow to a part of the brain. The lack of oxygen and nutrients can cause brain cells to die. Ischemic strokes are the most common type, accounting for about 85% of all strokes. There are two subtypes of ischemic strokes. Thrombotic stroke, caused by a blood clot, thrombus, that forms within an artery supplying blood to the brain. Embolic stroke, caused by a clot, embolus, that travels from another part of the body and lodges in a brain artery, blocking blood flow. Hemorrhagic stroke. This type of stroke occurs when a blood vessel in the brain ruptures and leaks blood into or around the brain. The excess blood can put pressure on brain tissue and damage it. Hemorrhagic strokes account for about 15% of all strokes and are often more severe than ischemic strokes. There are two subtypes of hemorrhagic strokes. Intracerebral hemorrhage. Bleeding occurs within the brain tissue itself due to a ruptured blood vessel. Subarachnoid hemorrhage. Bleeding occurs in the space between the brain and the tissues covering it. Common risk factors for stroke include high blood pressure, smoking, diabetes, high cholesterol, obesity, sedentary lifestyle, excessive alcohol consumption, and certain medical conditions. Family history, age, and race can also contribute to stroke risk. The symptoms of a stroke can vary but often include sudden numbness or weakness in the face, arm, or leg, especially on one side of the body, confusion, trouble speaking or understanding speech, sudden trouble seeing in one or both eyes, trouble walking, dizziness, loss of balance or coordination, and a severe headache with no known cause. Stroke treatment depends on the type of stroke and how quickly medical attention is received. Ischemic strokes can sometimes be treated with clot-dissolving medications if caught early, while hemorrhagic strokes require managing bleeding and addressing the underlying cause. Rehabilitation is often necessary to help individuals recover physical and cognitive functions after a stroke. Recognizing the signs of a stroke and seeking prompt medical care is crucial for minimizing potential brain damage and improving the chances of recovery. The acronym FAST, face drooping, arm weakness, speech difficulty, time to call emergency services, is often used as a quick way to remember stroke symptoms and the importance of seeking help immediately.